So, good day everyone. I am Janice Alay-ay from North Valley College Foundation, Incorporated, taking a Bachelor of Science in Nursing, Section A. So for today's turn demonstration, I am going to perform the Leopold'S Maneuver. So Leopold'S Maneuver is used to systematically palpate the gravid uterus. And also, it is done to perform a non-invasive method to determine the position, presentation, and engagement of the fetus inside the uterus. So Leopold's maneuver is done after 36 weeks of gestation. This is to help the expectant mother and the healthcare provider to be prepared for the labor. And also, it helps us to know if it is much safer to perform a cesarean section. So prior to the conduct of this procedure, I already secured all the equipments that I'll be using in the said procedure, and that includes a pillow, a clean towel, and a stethoscope. And also, I already performed a hand washing. This is to protect my patient and myself for the exposure of the microorganisms and infection. So, good morning, ma'am. I am Janice Alay-ay, and I will be your student nurse for today. So, may I see your wristband? Can you state your name and then your age? Okay. So, what would you like me to call you, ma'am? Okay, ma'am Jess. Before we proceed to the procedure, I'll be explaining further instructions for you to be able to have the idea. So what I am going to do is I'm going to perform the Leopold's Maneuver, and this is a method to determine the position of your baby, and I'll be exposing your abdominal area and feeling your abdomen and add a little pressure on it so that I can feel and determine the position of your baby. So would it be fine with you, ma'am? Okay, thank you so much. So the next thing that we're going to do is we are going to close the door for the privacy of the patient. Okay, so before we proceed to the procedure, I encourage you to void first. This is for you not to feel uncomfortable while doing this procedure. Okay. So are you done voiding, ma'am? Okay. I need you to lie down and slightly flex your knees. Okay, thank you so much. So can you turn to your side? Because I'll be putting a pads underneath your hips. Okay, thank you so much. Okay. Okay, thank you so much. So, is it fine with you if I'll expose the abdominal area so that I can be able to start the procedure? Okay, thank you so much. So now we are done with the preparations, and we are now going to proceed to the said procedure. So the first thing that we're going to do is we're going to perform the first maneuver, which is the fundal grip. So now face the patient and palpate the uterine fundus. This is to determine which part of the baby is at the upper part of the uterus. So this might be the fetal head or the bridge. So the fetal head feels round and this hard, freely movable and ballotable, and the bridge feels like softer and nodular. Okay, so let us proceed to the second maneuver, which is the umbilical grip. So the first thing that we're going to do is we're going to palpate downward to the lateral uterine surface. This is to determine the fetal extremities or the fetal back. Apply gentle but deep pressure. Okay, so now let us proceed to the third maneuver, which is the pollex grip. So I am going to use my hand or place my hand on the synthesis pubis and grasp the lower uterine segment. And I'm going to use my thumb and my finger. And also this is to determine if the engagement has already occurred. Okay, so now let us proceed to the fourth maneuver, which is the pelvic grip. So in this stage, we're going to determine the findings on the third maneuver. And also we're going to determine the presenting part that is in the hypogastrium of a mother and also the cephalic prominence. So if the prominence is at the same side of the extremities, then the head is flexed. And if the prominence is at the same side of the back, then the head is extended. Okay, so now we are done performing the Leopold's Maneuver. Now I'm going to locate again the fetal back and listen to the sounds of the fetal heart or the tone. So now I'm gonna go cover up my patient. So after doing the procedure, I have determined that your baby is at the right side and it is in the lower part of the uterus, and also it is in the cephalic position, and it is engaged, and it is the ideal position of the baby for the labor. And also when I was listening on your baby's heart sound, and I counted it, it was 125 beats per minute, and that is normal. So do you have any questions, clarifications on or concerns, ma'am? Okay, thank you so much. So thank you so much for your cooperation, ma'am. So after doing all the procedures, it is really needed to perform a hand washing. So I am going to wash my hands. So now I am done washing my hands, and the last part of this procedure is the documentation. So in documentation, it is important to include the findings of all the procedures. So thank you, ma'am, and thank you everyone, and that's all.